So we have this guy with us, this handsome guy. We're planning to do rhinoplasty with septoplasty. We call it septorhinoplasty. His main concerns, breathing issue. He's been having this problem for many years. He's shown many ENT surgeons and they've suggested septoplasty for him. At the same time, he has a bent nose, a deviated nose, a nose that's broad near the bony aspect. All of this we're going to take care in one go. Right, we've taken this cone beam CT scan, that's him in front of us. And if you look here straight, you'll appreciate that the nose is not straight, it's bent towards his right. And yeah, I think that's visible now. The whole nose is moved bodily towards the right. So we're going to do the osteotomy. It's also bulbous here. So this part I'm going to narrow and make the nose absolutely straight. That's the main goal for us. Also, or rather more importantly for him, is a septal issue. So we're going to correct that too. Now you look at his nose, there's a small hump, very teeny weeny hump, and there's actually a narrow point here after the dorsal. So the dorsal aesthetic line, there's a little bit of a break. So I'm going to get that also fixed. Alright. Now we'll go and show you his septum and what we find on the scan. This is his cone beam CT scan that you have in front. And I'm going to go and show you first on the axial view. So that's his septum. You see it's deviated towards one side, making this opening way too large and making this one very, very narrow. So by moving the septum onto the midline, by removing this spur, we're going to ensure that his nasal airway gets more cleared. And so that is, you can see that here again. Okay, that's on one of our views. Now we're going to show you also on another view. Again, you can see this, how there's more space on one side and there's that bend. You see that? It's probably much more clearer on this view. There is a level of clearer. It is full 90 degrees angle. அப்புறம் திருப்பி இப்படி வருது ஒரு நாட்சிங் இருக்கு வெரி ஸ்ட்ராங் ஸ்பர் அது நம்ம வந்து இப்படி எடுத்து ஸ்ட்ரைட்டா பண்ணிப்போம் then you'll have more breathing space. So this is very clear, I think, on this view. I'm going to enlarge this so you have a clear understanding of what's happening. That's what I'm saying. This is the nasal both sides, and that's the septum in the midline, bony septum, cartilage septum. Look at that bend. It's like a notch, very severe notching, having total obstruction in that area. I'm going to come more ahead, that's fine. But as we go behind, and you see, so the entire septal work needs to be done. There's a little bit of a bony aspect also on the midline. So we're going to take care of that. Let me see his cross-sectional view. Same thing in a different way. And all right. So I've clearly shown you the major issues having with the septum. The septum is totally bent, it's occluding on one side. You're going to get that fixed. I'm going to do a little work on the nasal dorsum, but mostly around the fact that the nose is deviated. So he will need osteotomy for sure, which means 5 to 6 days, even 7 days of stay here. Splints will be needed, both external and internal, meaning the nose will be packed. And remember, bony healing takes 4 weeks, which means you need total 3 to 4 weeks rest for the bone to be healed in the new position. Right? That's 1 week, after 2 weeks. So that's a very, very basic time frame that we're talking about. This is all for primary and secondary healing. As far as this kind of major septorhinoplasties are concerned, the eventual healing might even go on quietly without anybody's knowledge for as long as 6 months. Purida? Right. Thank you.